Welcome back. Our final guest on Community Health Matters is Alida Zappone, clinical social worker at Vista Community Clinic. Welcome, Alida.
Thank you for having me.
Yeah, I'm so happy you're here.
Thank
so
you.
What is your role as a licensed clinical social worker at VCC? What is that?
Well, my role as a licensed clinical social worker, and people use the term LCSW for short, is to provide behavioral health services to the patient to make sure that all their behavioral health needs are met. So what does that mean? I would do a psychosocial assessment on the patient to see what the problem areas are and to establish a treatment plan for them. I also provide psychotherapy, which is psychological therapy, and there's different types of those that exist, which I can talk about a little bit later. I do health education because some patients are sometimes confused about what their diagnosis is, either their physical diagnosis or their mental health diagnosis. So I help educate them on what that might entail and what kind of things they can do to better their physical and mental health. And I also do resource coordination. So I would refer patients to sometimes just basic needs, survival needs, food, clothing, shelter, maybe domestic violence shelters, or anything that they need, whatever they need to take care of their mental health.
Walk me through this, because is it fair to say that you do, is it an assessment that you do?
Yes. So as human beings, we are very complicated and we are made up of different aspects of ourselves. So I do a biological, psychological, social assessment. So I do, we talk about with the patient, what are some of maybe some genetic things that they've inherited from their families, either health-wise, physically, or mental health issues. We can inherit certain tendencies to have certain medical or mental health issues from our family. So that's a biological aspect, what's going on with their biology. And then I would talk about what's going on with their psychology. So what kind of thinking patterns do they have that affect the way they feel about their life or situations that they're in? And then what does their social network look like? So are they connected? Are they isolated? Do they have positive relationships with their family members, or are they more conflictual? So I look at the whole patient and all of the aspects of their life that make up them. And each person's an individual. Our experiences through life, childhood, adulthood, maybe traumas that we've experienced, all these things influence how we feel about our life. So I think it's important, that's the approach I take as a licensed clinical therapist, to address all of the aspects of the patient.
When a patient comes to VCC, and Dr. Bennett and I were talking, because he also does assessment, it feels like Vista Community Clinic is a real team-oriented and how to get to the...
Absolutely.
So if they come in, do they come and see you first? Do they see someone like Dr. Bennett? How does that
Yes.
work?
Well, usually they come in for a primary care checkup, so to their doctor, and they may be coming for some type of physical, medical issue. Maybe just a checkup, or maybe they're suffering from some type of chronic illness that would be something that's kind of permanent and needs to be monitored by the physician and regulated with medication, maybe a lifelong thing. So the patient comes, and then the primary care provider does an assessment of maybe some depression, anxiety. Maybe they come out high on that assessment. They're having certain symptoms that maybe the doctor feels like they wouldn't benefit from mental health services. They would benefit from therapy or psychiatry, or the combination of both. So if the symptoms are very severe, the patient may need both psychiatric intervention and therapy with the licensed clinical social worker.
So it's the primary care physician, like I think we said earlier on the show, who then says to the patient, see this psychiatrist?
They identify,
I
yes.
see, okay.
So they would say, this patient might be a good candidate for behavioral health services. And that's how we get our patients. Now, psychiatrists, they refer to me as well. If the patient's just getting psychiatric services, then they would sometimes refer to me if they need therapy, because usually both is most effective for treating depression. Or if I'm seeing a patient and they need some extra help or they may need medication, I do refer to the psychiatrist as well. So we work as a team.
That's awesome.
Yeah.
It really is. And you mentioned depression as one of the conditions that
Yes.
you personally have treated.
Yes.
What are there any others that you're seeing, like more than you know, what are like the top
Yes.
ones that you're
Yes.
seeing?
Well, issues that patients have, you know, everyone is trying to get through life and succeed in life, right? And we deal with stressors. So sometimes those stressors get so hard and so difficult to cope with that we need someone to help us, and that's where I come in. So I work from a strength-based approach. So I try to focus on the patient's strengths, which is kind of rare nowadays that you would focus on the strengths and their things that are going really well in their life and the coping skills that they already have, and I build upon those. So some of the issues that patients struggle with are depression, and it's very common. In fact, 7 to 8% of adults in the United States are suffering from depression, so it's very common. Another issue that a lot of people do struggle with is anxiety, and about 18% of adults in the United States are struggling with anxiety. So depression and anxiety I have found in my practice at VCC to be two of the top kind of issues that people struggle with. What do those look like? Well, depression, people often have maybe symptoms that are lasting 2 weeks or more, and there's various symptoms, but major depressive disorder would be kind of having trouble sleeping, maybe insomnia, maybe hypersomnia, which is sleeping too much, having trouble getting motivated to do things that kind of used to bring joy in their life, and they don't want to do the things anymore, feeling bad about themselves, maybe some suicidal ideation. So these are some symptoms that a patient might be suffering with who have depression.
Okay, and there's another term that at VCC, a primary medical home, I hear. What is that?
Yes, the primary medical home is just what it sounds like. It's a home where all your primary medical needs are being met. So you have everything in the same place. You have physical therapy, you have women's health, you have dentistry, psychiatry, primary care. All of these things are in the same place. So it makes the patient feel very at home and comfortable. And what primary medical home's purpose is patient-centered comprehensive health care. So that's the most important thing. You're meeting all of the needs of the patient, because we are made of, you know, so many different complex issues and needs. And if you only treat one need, if it's not a primary medical home, you're only treating maybe one or two needs, but there's more to the story. You've got to do the whole puzzle. You got to put all the pieces together to get a beautiful picture, and that's what I see VCC being. Each department is a different puzzle piece, and then you fit them together, and that meets the patient's needs, and they're happier and healthier, and they can live the optimal life they can live. That's our goal.
What advice would you give to someone that might be struggling with something like depression?
Yes.
And come to you.
Well,
and we got about 45 seconds.
Sure, you're not alone. You are not alone if you're suffering from depression or anxiety. Many people do. There are treatments for people who are suffering from these things. 1 out of 5 adults in the United States is struggling with a mental health issue. You are not alone. There's simple things that you can do. You need to pay attention to how your relaxation breathing helps. Sleep hygiene, taking care of how you're sleeping, you know, not cutting down on caffeine before you go to bed, cutting down on watching things that are very upsetting on TV before you go to bed. So these are some things that you can do. Exercise is one of the most important things for increasing serotonin levels, which make us feel good. They're a neurotransmitter in the brain that makes us feel good, and optimizing brain health. So there's simple things you can do, but if not, and it's not helping, come see us at VCC, and we're happy to help you to make your life better.